Hello, and welcome to your seminar on speech language pathology and how we can help you with Parkinsonism. Today, I'm going to really focus our conversation on dysphagia, but I don't want to forget the fact that I know that there are changes happening across sort of your motor speech, maybe the clarity of your mind. There are various things that can change as well, and those also are part of speech language pathology, and we can discuss those at any time kind of outside of this chat. But for today, I am going to focus on swallowing and changes that can occur to your swallowing as a result of Parkinsonism. So my name again is Alex Brandimore. I am a professor at University of South Florida in the Communication Sciences and Disorders department. I largely teach master's students to try to train the next generation to have specialization in some of these really challenging conditions that can result in swallowing trouble. And, if we think about all the things we love doing in life, they largely revolve around eating and drinking. And so we want to do our best to find ways to preserve that swallowing function, to keep you interacting with your families and friends, as life goes on. Okay, and so I largely teach the master's students, but I also do research in Parkinson's disease and Parkinsonism for swallowing treatment. We have a swallowing SEMG device that we're working with right now to kind of give you biofeedback about the strength of your swallow. And then clinically, I've worked at the University of Florida. I worked in a large movement disorders center there and got great training on how to deal with a variety of complexities. And it has informed my research and also informed my teaching. So my PSA above all things is make sure you go somewhere to be treated by people who have specialization with Parkinson's disease, but also the Parkinsonisms, the family of disorders, including PSP and CBD and MSA, that can occur as we age and we go through life. So my job is to help you as best we can. But when we talk about swallowing function, we are talking about a really complicated system that we failed to really appreciate because we've done it forever. Okay, but what do we do when that swallowing function changes? What do we do when it's not as easy to get food and liquid down into our stomach without things going down the wrong pipe? There really are two pipes, okay? So the first process is that, and I'm not sure you can see my cursor, but if you look to the far left of this picture, you can see this is a lateral view from the side of someone who's swallowing. They have a green amount of food in their mouth that they've chewed and masticated. Okay, they then are going to move that bolus, move that food towards the back of their oral cavity, and then they need to get it safely past this little epiglottis that has to flip over to help protect the airway. Okay, your airway is right here, going down to the lungs, but you can see that the esophagus is a smooth muscular tube right behind it. And where we get into trouble is when we start to cough and choke on solids and liquids too frequently. Okay, we all do it every once in a while, but it's about the amount that we're aspirating or that's going into the airway. We don't want that material collecting in our lungs. We don't want bacteria and infections to develop there, because that's what gets us put in the hospital. And then we are laying in bed and it makes us sicker in a lot of situations. So my job is to evaluate people using a video x-ray. I'm going to show you how I do that in a couple minutes, but there are a couple different ways to do it actually. So when you receive an evaluation from a speech pathologist, my most valuable tools that I have are my eyes, but my ears and also my hands. So what some of you may have experienced is when you first notice some of the changes in your motor function or in your ability to walk, or you were falling more, that you were first diagnosed with Parkinson's disease. That's typically what people are initially diagnosed with. But then after trying dopamine and it not working, or maybe symptoms not following a typical Parkinson's disease pattern, you found that your diagnosis was changed and you were given PSP or MSA or CBD or something like that. So one of the ways that I work with a neurologist is actually using my ears and listening to the speech patterns. And there is a very specific speech pattern for Parkinson's disease that's different than the speech pattern for PSP, that's different from CBD and different from MSA. So oftentimes a neurologist will come down the hallway and say, hey, Can you listen to this person's speech? I just want to make sure that I'm seeing what I'm seeing. Can you tell me if, what your impressions are? So I use my ears all the time. My eyes are really important for sort of this visual assessment of your swallowing mechanism. So the picture on your right, there's a test. It's called a video stroboscopy or a laryngoscopy, lots of names for the same test, where I put a flexible tube down in your nose. It's very tiny, so it doesn't actually hurt that much. But if I position it correctly above your vocal folds, I can watch how the vocal folds move. I can also watch how you're swallowing. I can see if there's too much residue in the mechanism or if things are going down the wrong pipe, so to speak. The other way that I can do this swallowing test is in radiology. And this is a video x-ray machine. You'll sit in a chair, generally right to the left of that. And then that big piece of equipment sits right next to you. It's going to take a video x-ray. So there is a small amount of radiation, but again, we keep it under a couple minutes at max that you're exposed to that. And then this is the view that I am able to see. So this is a lateral x-ray of you. Okay. So you can see the cervical vertebrae, that's your neck, your spinal cord. And then I can watch what you consume and make sure that nothing is going towards the airway. It's all going into the esophagus. Now, if things are going towards the airway, you may say, well, I cough and choke all the time. Does that mean that I'm aspirating? It probably does. We need to be listening for, okay, so when you swallow, does your voice sound wet? Does it sound gurgly when you talk? Are you feeling the urge to cough and having a really hard time coordinating that cough? Those are things that start to give me pause. Okay. Those are things I want you guys to be paying attention to so that you go to your speech pathologist or to your neurologist and say, I'm having some swallowing changes. I'm drooling more. I can't cough. I've had some patients tell me, something will go down the wrong pipe. I feel this urge to cough, but I can't cough strong enough. I end up kind of clearing my throat for an hour because I'm pushing. But that's not honestly the most effective way to clear the airway. Okay. And we'll talk about how we kind of rehabilitate that here in a second. So this is the view that I use. I'm going to give you things to mimic a meal, some thin liquid like water. I'm going to give you some puddings, maybe some cracker, maybe a pill. God knows swallowing our pills is important, and we want to make sure that it's safe. One of the easiest ways to make swallowing your pills safer is just to mix it in something thicker. Okay, trick your brain so that it swallows it in a more coordinated fashion. So mix it in your morning yogurt or in a nighttime pudding or something that's more viscous, that's easier to coat and get down. Everyone has trouble swallowing pills. We just want to make sure we do it safely and nothing goes into the airway. That's honestly the goal. So again, what does the speech language pathologist, they'll say that we're just speech therapy, but the reality is we're swallowologists, okay? We're speech language pathology. And there are lots of things that we're going to focus on. So my evaluations generally for Parkinsonism involve a speech evaluation, so that if someone says, I'm having to repeat myself all the time, I can't get my message across, hey, let's intervene with that. Let's figure out, hey, are there some actual motor speech treatments you would benefit from? Is there some sort of alternative communication system? We all are familiar with phones and with texting. That's a form of alternative communication. But what if we were able to type it and push a button and the phone would speak for us when we're tired or when we're really having a hard time getting that message across? For swallowing, again, I'm assessing swallowing safety. Hey, and maybe you have no changes. Maybe your swallow looks beautiful. But my job, because we know that swallowing changes will likely occur in Parkinsonism, is to stay on top of it so that as soon as we start to notice changes, we're intervening as quickly as possible. Those are always my goals. And then cough. As I said, we can protect you by swallowing safely, but on the other end, if you do aspirate, we need a way to cough as violently and strongly as we can to blast that stuff out of the airway. Now, I will say cough has become taboo post-COVID. Everyone is like, oh, don't cough, like it's the plague. But for you, okay, and for the ones we love, cough is one of your most important mechanism. It creates the most ballistic shearing forces that you can create in the human body to clear the lungs. That's the whole purpose of it, is to clear the lungs. And again, oral hygiene is going to be big here too. We don't want to aspirate material if we've got a lot of bacteria in here. So maybe you need someone to help you brush your teeth. Maybe we need an electric toothbrush. Maybe we need a pharmacological rinse that's going to help keep good bacteria in the mouth, but bad bacteria out. There are lots of things we can do to keep you safe, but that's what a good speech pathologist is going to focus on, is kind of looking at you from all those different angles. Okay. So how we can help you with speech and swallowing. So there are a couple routes. Number one, I can give you compensations. I'll show you a couple of those, things like maybe thickening liquids. You've heard about this. And maybe you don't like the idea of that. You don't want to swallow things that are thicker. The reason that that's recommended to you often is because thicker things are easier to control. Okay, if I pour honey on this table, or I pour a smoothie, it's going to move much more slowly across my table than if I take a cup of water, and it just goes everywhere. So thin liquids are the most difficult to control. And so in some cases, maybe I'll recommend something thick for a period of time while I'm doing rehabilitation to try to strengthen your muscles, improve the coordination, and again, make what once was automatic now very conscious. You're going to take more ownership and control of your swallowing to improve the functioning of that mechanism. Okay, so here are some of the options to talk to your speech pathologist about. I think what bothers me the most is when people are like, oh, I saw a speech pathologist once and she told me to touch my tongue to the roof of my mouth 20 times. And in my own mind, I go, that's great. That's great. But I want whatever you do to be functional for for where you are. Okay. Your treatment needs to be tailored to you and to you specifically. So there are ways to, let's say that you have a lot of strain in your voice. You have a lot of strain. That maybe I need to help find ways to reduce the muscle tension, reduce that spasticity, especially in your larynx. You have very tiny muscles in there that can get strained, that we may need to relax. And then at the same time, I may need to partner it with something like LSVT. That's the only one I put here, but Speak Out is another great one. We need to balance what LSVT and Speak Out do in Parkinson's, which is get them loud. We need to balance that increased loudness with making sure we don't make you more spastic in the process. So this is a little bit more of an art with the science, okay? Rate control, certain Parkinson's disease and Parkinsonisms patients will get faster or slower. I may need to do some therapy to kind of modify your rate a little bit. And honestly, changing loudness tends to control that best. There's also delayed auditory feedback. I'll explain that in a second. There are also surgical interventions that can be recommended. For some patients, they actually have spasms. Okay, so spasms when they talk, they're going to talk like this, and it's kind of choppy, and that happens. But in those cases, Botox can actually be helpful. Versus some patients will have bowing or atrophy of the vocal folds. They don't come together all the way. They should come together flat. They come together kind of bowed. You can actually inject the vocal folds, and ENT would generally do this to help medialize the vocal folds and make them you'll maybe sound a little less hoarse, a little less breathy, if that was happening to you. And then, of course, there are device-driven treatments. Again, I mentioned some of those alternative communication systems. There are pictographs ones like you see here. This is a Tony Dynavox product. But there's lots of different options. There's also, I've downloaded apps so that my patients can actually type a message that they want to remember to say to their neurologist, and then they just have their neurologist read it, or they push a button and it speaks for them. You could choose a voice that sounds French, you could choose a voice that sounds British, or a voice that sounds more like you, and that would be appropriate. And then EMST, I'm going to show you that. And then, of course, just trying to educate your loved ones or the people who are helping care for you and going through this with you, because they need just as much support and want to feel empowered to help you as best they can as well. For swallowing treatments, there are behavioral exercises. There are actually exercises that I recommend based on what I see on that video x-ray. To strengthen the back of your tongue, or to strengthen the muscles of your throat that actually, where residue can get collected. I could strengthen those muscles that way. There are devices Expiratory muscle strength training is one that I love. I'll show you what that looks like here in just a second. And again, we could modify diets. Some of my patients don't have teeth and they forget to wear their dentures. So I'm going to recommend a diet that's a little bit easier to chew. Okay. There are also some postures when you eat that are easier and keep your airway safer. Not for everyone, but for some people. Okay. And then if we got into a really severe situation where it was taking you a long time to eat or the burden of eating was just getting too great, we might begin a conversation about a feeding tube. Okay. A feeding tube can go, it can be passive. It can just be flushed with water to keep you hydrated. So you're eating everything orally, but you just have water flushes. But it also can help supplement eating so that it doesn't, the work of eating kind of is reduced. You still eat what you want orally for pleasure and for fun, but the work and burden of eating may be there. Okay. So again, I think I'm running low on time, so I'm just going to let you know about LSVT and Speak Out. They are very well researched programs to get you louder. Again, the trick with Parkinsonisms is you don't want to just do LSVT and get loud. Okay, it's an intensive program. I'm somebody who believes in stretching those sessions out over time as opposed to this burst therapy model. But again, this is you want to go to a speech pathologist that is willing to be flexible and creative based on evidence-based. You want to, them to know the literature, but be able to modify it for you. LSVT has been tested in Parkinson's disease, but you may not have that. You may have Parkinsonism, PSP, MSA, CBD, and for that reason, you need to maybe adjust it just a little bit. Okay, again, delayed auditory feedback. If you want to look up the Speech Vive, it's a really cool device. It actually plays background noise in your ear every time that it senses vibration. Okay, and so for that reason, it uses what's called the Lombard effect, and you naturally get louder because you think you're in a restaurant with background noise. So it's called the Speech Vive. There's also traditional delayed auditory feedback devices that help control rate that a speech pathologist could talk to you about too. EMST, this is a device that I've actually researched, and my mentor, Christine Sapienza, has researched quite a bit. It was developed at the University of Florida, but it's this tiny little device that you blow into as hard as you can. You'll wear nose clips, you'll grab your cheeks, but you can adjust this dial at the back, the white little knob, to make it easier or harder based on where your expiratory muscles and these muscles under your chin, what they can tolerate. So we set it to your particular strength level, and then every week we increase the intensity. You blow into it 5 sets of 5 times for 25 times a day, and that is that. Okay, so in summary, can anything be done? Of course, things can be done. There are things I want you to, begin paying attention to if you're having changes to swallowing, coughing and choking, losing weight without trying to. That's not a good thing. There are certain things we need to kind of just be aware of so that we intervene as quickly as possible to give you options. And there is a lot of hope. Lots that can be done. I wish you guys all the very best, and I will see you next time. Don't hesitate to reach out to CurePSP and to all the wonderful people there. If you have questions, they can reach out to me, and I'm happy to get in touch with you.